This training program is intended to educate healthcare employees whose part of their job requires them to lift patients or other heavy objects. Many times, when improperly lifting an object, such as a patient, one can sustain a back injury. Lifting and moving patients is one of the most important job tasks performed by a healthcare worker and results in one of the highest back injury rates in the healthcare industry. Based upon recent statistics, there are over 67,000 back injuries each year among healthcare workers. Annually, these injuries have resulted in almost $2 billion in workers' compensation claims. This training program will look at the following areas dealing with back safety and proper ergonomics. Structure of the back, common back problems, proper lifting techniques, correct posture, maintaining a healthy back. The back is made up of many structural and muscular components. Many individuals believe the spine is the only part of the back. Although the spine is integral to the back structure, it is only one piece of a complex part of the human body. The spine is the part of the back that supports the trunk and head. It protects the spinal cord as well as giving flexibility to the body. The vertebrae are small bones that form the spine. They are connected by spinal discs, which are like shock absorbers. The brain, along with the spinal cord, makes up the central nervous system. There are 31 pairs of nerves that extend out of the spinal cord and into the body. To support the back structure, there are approximately 400 muscles that help stabilize the spine and help with proper posture. More than 1,000 tendons connect these muscles to the spine. Any part of the back structure could cause problems, and if not working in harmony, can lead to other back issues. There are several injuries that can occur to the back. These injuries are often the result of years of neglect. A sudden movement or improper lifting technique can cause injury. Back pain can last a few days or become chronic. Many people have a genetic disposition to have bad backs, such as arthritis or other inherited diseases. Some of the most common back injuries include, but are not limited to, strains, which are commonly caused by overstretching, bending, lifting incorrectly, slouching, and carrying extra body weight. These strains are sometimes a result of just doing things that you shouldn't. Overflexion is caused by bending over too far, which causes pressure on the discs that can result in pain and stiffness. Sprains can usually be the result of sudden movements or twisting. Sprains are usually ligament injuries because the muscles do not have time to react. Such injuries frequently are the result of an accident or fall. Overextension is arching backward too far and putting all the weight of the load on the discs between the vertebrae. Ruptured disc is usually painful because the disc is literally torn open and the jelly-like substance leaks. Pinched nerve problems occur because the alignment of the spine or a growth on the vertebrae can cause a nerve that sends pain down the legs or causes numbness and tingling or pain in the arms, hands, or fingers. Muscle spasms is because a muscle receives too many impulses from the nerves, resulting a muscle to contract beyond a normal capacity. To minimize the possibility of any back injury, healthcare workers need to practice safe and correct lifting techniques. Whenever one lifts an object or a patient, some general guidelines are always necessary. First, never lift an object or a patient that is too heavy to lift by yourself. Always get help. If you find yourself needing to lift a patient into or out of a bed, wheelchair, or off the floor, please be careful not to hurt yourself or the person you're lifting. Lifting of patients is probably one of the most strenuous activities for most healthcare workers. When lifting or moving patients, always try and use available equipment. When using equipment, it is always important you have been properly trained on the use of the equipment. Plus, it is important that you have had properly supervised practice before you use equipment to lift patients. However, the use of equipment will not always be an option. When manual lifting is necessary, follow these guidelines. The use of proper lifting and handling techniques can help protect your back and ensure safety of the patients. Always know the weight of your patient and consider the mode of transportation, such as a gurney, stretcher, or wheelchair. Be aware of your own limitations and be realistic. If you cannot safely move the patient or an object on your own, get help. Whether you're working alone or with a partner, know how you plan on moving the patient, what steps you'll be taking, and what you'll do if your plan isn't working. Communicate both with your partner and with the patient you're about to move. When everyone is ready, injuries can be minimized, and all efforts are more efficient. Use verbal commands and know when to stop. Align your head and neck with your spine to minimize the risk of strains and sprains. Always bend and lift with the knees, not at the waist. Bending at the waist puts unnecessary stress on your lower spine. Avoid twisting your body, especially when bending. Hold the patient close to your body while lifting and transferring them. The closer you hold them, the easier it is to maintain your natural center of gravity and remain steady on your feet. By extending your arms, you may engage other muscles, which can increase the risk of slips, falls, and possibly dropping your patient. Maintain a stance that is shoulder width apart, thus helping maintain your balance and distribute your patient's weight evenly. The longer a patient is confined to a bed, the more likely it is that you will have to, and sometimes reposition them, both for their comfort and to avoid pressure ulcers or bed sores. This requires that there is a sheet or pad that is already positioned under the patient. It is recommended that this maneuver be performed as a two-person technique. First, lock the bed rails to prevent accidental falls. Raise the bed to waist height for better spinal alignment for both you and your partner. Roll the patient from their back to a side position. Have one person grab the edge of the draw sheet or pad while the person on the opposite side of the bed gently holds the patient's side. Additionally, the patient can grab the side rail and pull themselves as you pull the sheet or pad behind them. Then you can lift the patient into a waiting stretcher or another bed. Proper technique for moving a patient from a bed to a wheelchair. Identify the patient's strongest side and position the wheelchair on that side. Lock the wheelchair's wheels to secure its position. Raise the bed until it's slightly higher than the wheelchair. Never pull a patient into a seated position. Instead, either use the bed's electric controls to raise the head of the bed, or help them roll first onto their side facing the wheelchair and then pushing them up, first to their elbow, then their hands, until they are seated fully upright. You may have to help them by supporting their back and helping them swing their legs over the side of the bed. Keeping your legs shoulder width apart, your back straight, and your knees bent, lift the patient until they are in the standing position, otherwise known as the sit-to-stand lift. Pivot the patient until they have their back to the wheelchair. If possible, let the patient feel the arms of the locked wheelchair so that they know how far away it is. Do this slowly, And with conscious, continued effort, you want to guide them, not push or pull, as sudden movements can unsettle their balance and yours. This same technique can be used to help a patient from a sitting to a standing position. With a little practice, properly adjusting or moving a patient can be an easily accomplished, safe task. Good posture is necessary to maintain a healthy back. When sitting or standing for long periods of time, posture can affect the back either positively or negatively. It is important to learn the correct way to sit and stand, things to do to support the back while sitting or standing, and exercises to perform while sitting and standing. When sitting, keep your knees at a 90-degree angle and feet flat on the floor. Slide back in the chair and sit straight up. Putting a pillow behind the lower back can help provide support. Exercise while sitting by tightening the stomach and buttock muscles and holding for 5 to 10 seconds. Occasionally, get up and walk around if sitting for prolonged periods. Make sure when standing, do not slouch with the back bent. Keep the back straight, shifting weight from leg to leg every few seconds. Hold shoulders slightly back and keep chin, abdomen, and buttocks tucked in. Standing puts less stress on the back than sitting. Shift positions frequently. Raise one foot on a stool or step when standing stationary for long periods of time. Preventing back injuries requires proper lifting, good posture, exercise, and proper diet. The back deteriorates with age, and it is important to do everything possible to keep the back healthy. Performing certain exercises will strengthen the back, stomach muscles, and leg muscles, increasing the chance of maintaining a healthy back for many years. Here are 3 things you can do to help your back. Always try and wear comfortable and supportive shoes. Maintain a proper weight, which will reduce stress to your back. And finally, by exercising daily, you will strengthen your back and increase flexibility. Know the proper techniques for lifting an object or a patient. Do not ever try and lift an object or patient that is too heavy for one person to lift. Always get help. Maintain good back posture when you're lifting, sitting, or standing. Proper stretching before work or exercise will reduce strain on the back.